And we are live. Should kick, but I'm not going to. On a Monday. Good morning to you and yours, and welcome to it for Oran Poppin Chats. We call this Clinical Monday live on our Oran Poppin's Facebook page and also on our YouTube channel. And my name is Nkosi, and I'm your host behind the scenes, making sure that all things is smooth sailing is our technical producer, who's also an author, Happy Phaleng, and my guest this morning, talking all things syphilis. Since you know that February from the 12th until the 16th, we are shining the spotlight on all things condom and STI week. I'm joined by Sister Buhle Tshatsu from Oran Pop in Tswane. Thank you so much for your time.
Thank you, V.
And you can be part of this conversation by partaking in the topic. We're talking syphilis, like I said. Leave your comment on the comment section below on Facebook, also on YouTube. You can find us also on our TikTok. It is at Oran Pop in. With Twitter as well, it is at @in_health with the hashtag Clinical Monday. Let's not even waste time. Let's just jump straight into it. People understand what STIs are. You know, they're sexually transmitted infections. But we're shining the spotlight on syphilis, which is one of those STIs. In your view, what is syphilis?
Right, V. So syphilis is basically a sexually transmitted infection, and then it's caused by the bacterium Treponema pallidum.
Yeah.
So this bacterium causes infections when it gets into broken skin or mucous membranes, basically.
Okay, let's talk about how common syphilis is, and I want to say how common it is to other STIs.
Well, it's relatively common. So the WHO did a research and it estimated around, this is for most of the common STIs, and then 374 million new infections, with one of four STIs. Chlamydia was like 129 million, gonorrhea was 82 million, syphilis was 7.1, and trypanosomiasis was 156 million. So it's there, but it's not as hectic, but it's common.
Most definitely. And I wanted to shine the spotlight on MSM and transgender women and try to understand, how common it is between them. But, let's touch on curable and non-curable. I know that these STIs are sort of segregated or segmented. We have those that are curable and those that are incurable. With syphilis, where are we standing? Is it curable? Is it incurable?
Well, the good thing with syphilis is it's very curable with antibiotics.
So easy. I thought you were going to read me a script.
Just like that.
Yeah, what's that common azithromycin, one of those common antibiotics that we have. In how it presents, we need to talk about the symptoms. Obviously, we know what it is. We know that it's curable. What are some of the symptoms? And at what stage should one? Okay, let's start with what are the symptoms of this STI, and talk about the stages then after.
Well, I'll just sum up your question into one. There's 3 stages, right? Stage 1 includes where a painless sore, the person, whatever, will see a painless sore. This sore is called a cancre, and then it appears at the site of infection, right? And then stage 2 presents with fever, headache, sore, throat, anemia, and general rash, right? And then stage 3, this is the syphilis when it occurs after an asymptomatic phase. So with all these symptoms, people should know that with stage 1, the symptoms can take 1 to 3 months to show. Stage 2, it can take 3 to 6 months. Stage 3 could take years. So
I got you. Does it then depend, or does it vary from an individual to an individual? So if I were to have syphilis, maybe it would present differently, maybe because I'm a different human being as opposed to somebody else.
No, not at all. Symptoms may be experienced differently from person to person as the infection progresses. So the only difference would be maybe you in stage 1 and I'm in stage 2. But
definitely,
it's the same situation.
I got you. I want us then to talk about it being transferred or it spreading. The common ways we know that sexually we're only thinking penetration, where it is between an anus with an anus with a penis or a vagina with a penis. But what are some of the common sexual ways that this kind of STI, well, specifically syphilis, is
so one of the common transmission ways is during anal sex, oral sex, vaginal sex, and also rooming. So people should know that it is also passed from like direct contact with the sore, because remember by stage 1 there's a sore. So wherever, if you have direct contact with the sore, then
let's not touch sores. because we might get the infection. Let's talk about how we're controlling it. We are looking at condom and STI. We obviously, we need to couple it with a condom every time when we speak about sexual health, or STIs. But how do we control the syphilis?
Right, so measures to prevent and control the transmission of syphilis include you start with counseling the patients, prompt diagnosis, and appropriate treatment of the person. And basically the most important thing is telling the person that, listen, yeah, you are treated, yes, but can you bring your other sexual partners to please come test? Because I can't treat you and then you're going to sleep with me as your partner and it's going to reoccur again. It makes no difference.
Definitely. So it touches on that reinfection aspect of it. Share some of the ways that you, or the experiences that you've had with STIs. And I mean, we just touched on, how to control it. Let's talk about prevention. How do we best prevent syphilis?
The only certain way to avoid syphilis is to abstain from sex. But the most common way is basically condom
demonstration. And we'll have a condom demonstration during the session where we get to understand how to use a condom properly, because we do mess it up sometimes. And you can share some of your journeys or some of your questions and comments with us on the comment section below. Also Twitter, it is @n_health with the hashtag clinical Monday. Reinfection, you touched on it when you touched on the partner notification slip, where a person who is infected needs to notify the partners that they have slept with to prevent reinfection. But when you talk about reinfection, what are we talking about?
Right, so people having syphilis once does not protect patients from not getting the disease again, right? Yeah. So even after successful treatment, patients might still be reinfected by unprotected sexual intercourse. So if you're still going to have unprotected sexual intercourse, you will have it. So the safe way, condom use.
Condom use. We do have nice condoms, the free ones, because if you cannot afford it, there's always available condoms and loops. But nonetheless, let's move. Let's talk about if it cannot be treated, what happens then?
Right, so if it cannot be treated, primary syphilitic cancers will heal on their own. Yeah. So that is the source from the stage 1. But the infection is still present. So also what is important, untreated syphilis can accelerate HIV in people who are co-infected. And then people should know that with the sores, remember I told you about the stage 1? There's that sore. With that sore, it can heal on its own, even without treatment. But the syphilis will still be there, and then you will still be transmitting to other people. So you're actually putting other people's lives at risk, basically, and yourself. Yeah.
I wanted to talk about HIV and syphilis. Can one get them both? Because in my head, excuse my a little bit of ignorance, I'm thinking you need to be infected with one STI. I don't know where to take that.
No, not at all. Hey? Yeah. Dual infection is absolutely positive. Not positive, it is possible. Yeah. Remember that you can be infected by multiple STIs.
All at once.
So all at
once. Let's talk about what is the treatment. Then we spoke in the beginning, and I said azithromycin. But what are some of the possible treatments that are there for syphilis?
Right. So there's a before I treat you, I first have to ask questions to determine whether is it a late syphilis or early syphilis, and then I know what treatment to give you. So I have to ask, is there a negative syphilis result from the last 2 years? If the patient says yes, then it's an early syphilis. If they say no, it's a late syphilis, right? So with that, the treatment would start with injection called benzathine, benzyl penicillin, which is 2.4 MUIM, and then if it's early, you will just give one shot. Okay. And then if it's a late syphilis, you'll give this shot weekly 3 times. So like this week, you give one shot, the following after 7 days, Yeah. And then what is important is if this patient, because the benzyl penicillin is penicillin, there's some patients that are penicillin allergic, right? What you do, or maybe the benzathine is not available, what you do is you give an antibiotic called doxycycline, 100 milligram 12 hourly for 14 days. And this is if it's an early infection. If it's a late, you're going to give the doxy 100 milligram 12 hourly for 30 days, not 40 days. So it varies. So you have to know whether is it an early or late. You don't just, it's not a
all at once.
Azithromycin.
That's the famous antibiotic that I know, Buhle. So we touched on the treatment, and I wanted to then touch on the benefits of treating it early. What are the benefits of treating syphilis early?
Right. So the benefits of treating syphilis early is antibiotics can treat syphilis in the early stages, right? So syphilis doesn't cause long-term health problems if you receive treatment early. But without treatment, you can damage. I didn't even know this, but you can even damage your heart, your bones, your brain, your eyes, muscles, nerves.
A lot of things. Yeah.
So as soon as you see
something.
Make
sure that you pop in. Listen, Buhle, thank you so much for your time. And we encourage everyone to make sure that they know their STI status, where they stand when it comes to, especially this week, man, because we're focusing on condom and STI week. And you can pop in at Oran Pop in Swan. It's 416 Cakeness Street at Loftus Park Shopping Center. And we are live still on Clinical Monday. Can I call this the bonus Clinical Monday? We'll focus on condom demonstration. As you know, that the 12th to the 16th of February, it's condom and STI week. And I mean, we cannot talk about the STIs but not talk about the condom. We need to speak about the importance of condom demonstration, how to insert the condom correctly, and also talk about some of the benefits of using a condom, especially when it comes to spreading the curve of all these STIs, like the STI that we're talking about with Sister Buhle Tshatsu, which is the syphilis. Get that on all our social media platforms, as it will be nicely packaged for you. Well, my name is Nkosi. I didn't even introduce myself. That's how excited I am about this bonus episode of Clinical Monday. I am joined by Ben from Oran Pop in Tshwane, who is a counselor who will give us a condom demonstration and answer some of the few questions that we have when it comes to condoms. If you have any questions, please put them through on the comment section below. We are live on our Oran Pop's Facebook page. Ben, good morning to you. Thank you so much for your time. How are you?
Morning. How are you?
I'm great. I'm excited when I see you because it's gonna be fun. I know. Well, Ben, you do something called condom distribution. Before we get to the condom demonstration, just give us a sense of what is condom distribution.
At Oran Pop, we have what we call condom demonstration, right? Yeah. Where you have our team in different regions from 1 up until 7, giving out condoms, making condoms available.
Yeah.
You know, we are for the community, community people, because there
yeah.
are people who can't come, to our
Yeah.
clinics to town.
Yeah.
Yeah, that's where we go there, give them information about condom, show them how to use the condom, share information, the safety use of condoms, making things available and closer to the people and free.
Most definitely. So if you are in and around in all these regions on Sunday, make sure that when you see them, you pop in to get yourself some free condoms and lubricants, and of course some of the services that Pop in gives out for free. But now, Ben, we need to talk about condom use, how to properly insert a condom. Take us through the steps. What do we do first when we have to use a condom?
Okay, first of all, either you buy or you get it from somewhere available there.
Yeah.
But the most important thing is to check the expiry date, guys.
Yeah.
So the condom is like the signs at the back of the package. You will see your expiry date. This one is like a 2022-05, right? Which means it's still in good condition. And also check the pressure.
Yeah.
You know there is the air inside the condom.
Out, yeah.
So if the condom doesn't, it needs to bounce.
If it doesn't bounce, it's not right. This is not the right one.
Yeah,
it's bouncing. Yeah, it has holes. Got you.
Yeah. So if the condom is like this, not tempered, safety use, right?
Yeah.
So there is the side where you open the condom, right?
Yeah.
There's what we call the zigzag side. This side. This is where you open the condom, right?
Yeah.
So after checking your condom, you firstly need to put your finger here, slide your condom a little bit, right? To avoid your condom being torn or punching it with your nails. You know, right?
Yeah.
So after holding it like this, you need to just like slide here
and open.
My hands are
slippery.
Right? So we have another one open here.
Okay,
this one, right? So after sliding it, opening it, you firstly need to hold your condom like this, right? So you need to check, because the condom rolls. There's a side where the condom rolls and doesn't roll, right? So you're gonna use your finger to check, right? So putting your finger, you can see the condom is rolling downwards, right? So you need to make sure this part of the condom, you hold it or you pinch it. I don't know how you can say it, right? So this stays on top or the tip of your penis, right? So like this is our penis, right? So firstly you need to put it here, right? So this part, there must be an air here.
Right. Good.
Close it to make sure
Pinching.
the condom, pinching, right?
Yeah.
So you firstly need to put on top of the tip, right? Make sure it's hard.
Make sure it's hard.
Make sure it's hard. So you need to roll it down up until the base.
Yeah.
Right?
Yeah.
But make sure there's always a space here.
Yeah.
That you pinch.
I think that pinch is important. But, I want us to talk about how important that pinch is.
Yeah.
But okay, then you roll it.
Yeah, you roll it. Make sure the condom here, right? There need to be a space here for the air.
Yeah.
Right?
I got you.
So that's where the condom is nice, right?
Yeah.
It's rolled, then you're done, right?
Yeah.
You do the deeds.
You do the deeds.
The session.
The session, before we get to the session, there must be a loop. But before we get there, I want us to talk about how the importance of us using a condom. A lot of us, it breaks this thing. Why does it break? Why do you think it breaks? If it does it break because, and people have been giving reasons, which it breaks because, the session is rough or whatever. But why does it break?
So sometimes it depends if you put the condom vice versa. Right? Yeah, you put it vice versa. Condom wanna roll while you're placing it, right?
Yeah.
So the impact, it bursts.
Yeah.
And also the friction, you must lubricate. It depends. Others will get dry,
Yeah.
So whenever the friction, if the condom is there, it's gonna burst.
Yeah.
Yeah.
I got you. So that is correctly inserted. And then when do we apply the lube? Do we have, because I've realized your hands are very oily or slippery because of the lubrication, because condoms are lubricated. We think that condoms are not, but they are lubricated. And I've actually had some crazy stories then of someone saying they've used egg yolk to lubricate themselves. Why are we using, we have lube. Let's talk about the lubes. When do we apply?
So you must apply the lube on top of your condom, because sometimes the lube is not sufficient.
From the condom itself.
From the condom,
so you need to add extra lube.
Add extra lube on your condom, right? So that it could be like easy to slide in.
Yeah. I want you to demonstrate that. Spa, do you mind giving us a paper towel there so that Ben can wipe himself? While we do that, what are some of the stories that you've had, some experiences that you've had when it comes to condom breakage, some of the stories that you had? And if your condom breaks, I want to know, do we stop? Because the session is so nice, you don't even think, do we stop? We have to stop, right?
When the condom bursts, you need to stop immediately.
Got you. Yes, got you. Now, apply the lubrication for us, and let's see how we do it correctly.
Okay. Also, the lubrication, you need to check the expiry date, the most important part, regardless of the brand.
Yeah.
So the expiry date also matters, right? So there are others, they say they are silicone wise. Lube.
Yeah.
So lubricant. So this one is like also a tear thing, right? Yeah. So you need to tear. My hands.
Your hands are slippery.
So this one is So this one is 1 millimeter. 500 meters. 1 millimeter. It goes meters, right?
That's a lot.
So So if let me see, it's coming out.
Let me help you.
Yeah, please.
Because my hands are a little bit drier. Okay, there we go.
So
also help your partner.
You can help your partner. Equity trading, we exchange these things.
You know.
So you need to apply like the lubricant, right?
Yeah.
Firstly, you need to apply it. Some apply it here.
Same applied
here. Yeah. And then you must rub it, man. You can't put it here like.
And then leave it.
You must
all the way,
right around, right?
Yeah. Okay.
Then you put it right around. It's ready.
And then it's ready.
Then you slide in, right?
Then you have a nice time to enjoy yourself. So you've protected yourself from all the STIs that are out there. If you are, then this would be the first session. If you exclude what Buhle was saying about the rimming and everything, I want us then to say now the session has ended. The business is done. How do we properly remove the condom and discard it safely and correctly?
So you still remember the condom as a tip, right?
Yeah.
So that's where you come in. That's a storage for cups.
Yeah.
Be there.
Got you.
So you firstly need to hold it. Let's say this thing is slippery.
You are slippery.
Yeah. So you need to hold it at the back of the cam where the cam is, right? Yeah.
So we'll call it semen.
Semen
for
the
sperm.
Spams. Yeah. That's where your spams.
I got you.
Yeah. Right.
And then it will see teamwork is made for teamwork.
Roll it up.
Okay.
Yeah. So
you held it there at the tip.
At the tip. Yeah. Ne? So here the tip so that the sperms don't come out.
Yeah.
Right? So you need to tie a knot.
Tie a knot.
Yes.
Some of y'all don't tie knots.
You need to tie knots.
I didn't know that we have to tie knots. Okay, I got
You
you.
need to tie knots so that the thing's here. Then you need to put it. You can use your paper towel. Anything.
Yeah. And then safety discard.
Safety discard it. You put it in the bin.
I got
Flush it.
Don't flush.
You mustn't flush condom.
Don't flush the condom. Put it in the bin.
Yeah. So remember to wash your hands after.
Also,
yeah, you must.
I got you. Anyway, Ben, thank you so much. With that, if you want to find out more on this, you can definitely pop in and get yourself a session there with some of our counselors and ask them any questions that you have when it comes to proper lubrication and proper condom use. And you can also, don't forget to leave your comments in the comment section. And join us for the next one as we continue understanding STIs from curable to non-curable and how to definitely use a condom. Until next time, happy streaming.